talk about the physiological effects of aging. Okay, so let's start by understanding what is terahertz. Terahertz radiation lies between the microwave and the infrared region. So it's actually an infrared wave, okay? And strictly speaking, it is far infrared. And the frequency is given as this. Okay, this figure 10 to the power of 12 is trillion. So what is it used for? It's mostly used in that's very important. Telecommunication handphones use radio wave, okay? And if you're using a 5G phone, that wave has gone into the what is known as a microwave wavelength. Microwave is slightly shorter than terahertz. So 6G, which is coming, use terahertz frequency. And so 6G is supposed to be better, but there are some limitations. One is that it can't travel as far as microwave and other things. But the important thing for us is that almost every molecule in the body has a fingerprint because it vibrates at the terahertz. That is the important part. That's why it has all these effects. So this is what they call the electromagnetic spectrum. Here are radio waves. They are very long wavelength, very low frequency. Then you have the microwave. So 4G is somewhere here, and 5G is 6G will be in a terahertz. So these are all very safe frequencies. On this side, dangerous frequencies like ultraviolet, X-rays, and gamma rays. These are dangerous. They can cause your cells to mutate and change its function. So now the breakthrough in terahertz comes in the 90s when we began to have newer techniques. We can generate, monitor, and detect terahertz waves. 2011 was an interesting breakthrough where they used terahertz shine at a painting, and they discover that beneath the painting on the surface there's another painting with an artist's name in it. Of course, you know, in those days they don't have enough cameras, so they paint over old pictures. So this is what happened. They were able to do this. Now this is interesting because they don't have to break up the first surface painting. So this technique is being used. For example, I read that Qin Shi Huang, the tomb, right, which has a lot of terracotta warriors and all that, and a lot of things that cannot be exposed because they break up when they get exposed to air. They want to use techniques like this to study so that they don't interfere. In fact, these techniques have been used in archaeology for quite a while. You can see what's inside without breaking up. So that's the advantage of the terahertz. But before this, people talk about the terahertz gap. What do they mean by this? This means that microwave, radio waves and all that was studied under electronic, whereas higher frequency of waves study under photonics, under light. We study it as light because light is here, visible light is here, and terahertz between. So do we study under electronics or under photonics and the light? Of course, now terahertz is studied under photonics. And if you are into technical things, you know that China has started making chips that are photonic chips. And they're actually terahertz. So that's putting it in context. So applications of terahertz, very important, is use of 6G. It's definitely terahertz. And there have been studies of 6G for the purpose of telecommunication. You know that handphones at one time were said to cause cancer because you put the handphone close to your head. So as a result, to demonstrate safety, they used 6G or terahertz waves to study how safe it is. And there was a report that in fact 6G is very safe, which is terahertz, and that demonstrates that terahertz is very safe indeed. So it is used for military and security applications. That means you don't have to strip the person, you don't have to search a person. If you go to YouTube, you can see videos of how people can walk with things covered under their layers of clothes. Other security scanners cannot pick it, terahertz is able to do so. So that's the advantage. Why? Because it can penetrate plastic, textile, paper, cardboard, anything.
Sorry, is it true? The airport has...
I'm not sure whether they use terahertz. I'm sure they're using some scanners which can penetrate. Most of the time it is similar to, most of the time the scanners that use are in the ultraviolet region. So you can't have too much. That's why. So in agriculture, they use it to monitor. So I read a paper where they showed that they use terahertz to look at the leaves of plants and estimate the water in the, and from that they know whether a drought is coming. That's what is happening in China. It's a very amazing thing. So we're talking about health and science. That's why we're in. We make use of the fact that they resonate same frequency as a cell, and for that reason, that's why it's called the light of life. So healing properties of TeraHertz, there are two properties of TeraHertz heal. One is the heat because it's infrared. So in this, it shares the same property as normal infrared or the near infrared. Near infrared, if you have been to infrared sauna or attend a bonfire, right? A campfire or whatever it is where things are burning, you have a lot of infrared. You feel good because the warmth and it kind of open up your blood vessels and so forth and stimulates you. So heat, far infrared, there's TeraHertz share with near infrared, we know. But suppose you take away the heat, will it still have the healing properties? And that's what they did. They removed the heat, they just used the frequency alone, and they found that the frequency itself can heal as healing properties. That's why TeraHertz is unique. So it can make you feel good like near infrared or infrared, but yes, much better than that. It's vibration, the frequency itself can heal. That's why we have all the good things we hear about people recovering. Because if it's just heat, we can just use infrared. So it can be used for diagnostic purposes because you can look through and see what's underneath. So you can look at the bones, you can look at tumor, for example, if a tumor, you want to see how big the tumor is and how far it's spread. It can be used for that. And this is in fact much sharper than MRI and whatever things. So there have been a lot of papers. You go on the internet, you look for it, you find tons and tons of papers on this. It can be also for therapy. A lot of people have been using it for therapy. We are not the only company that has this. Few Taiwanese companies also have come up with devices to do that. Some TCM clinics have also TeraHertz devices, not ours doing the same thing. So why is it TeraHertz is able to heal? These are the problems. The first thing to realize is that unlike UV light and all that, is low energy. It doesn't ionize, it doesn't disrupt the molecules of human cells. So it doesn't cause your cells ache. Then the second thing is can penetrate through all kinds of things, wood, paper, textiles, plastic. So even if it's a piece of wood, you can shine and the other side you can pick it up. So of course it depends on the energy level. Low energy, it may not travel that far. You need enough energy to carry it through. You can penetrate. But the thing is, it's absorbed by polar compounds. What are polar compounds? Polar compounds are compounds that will conduct, now your water conducts. So that's why water can absorb. And it's also absorbed by human tissue. Human tissue contains water. 70% of human beings are made of. So it will be absorbed. And the energy corresponds to what is known as hydrogen bonds in chemistry, and these bonds are called van der Waals forces. Van der Waals forces are very tiny, weak forces that holds, if we talk about water, van der Waals forces holds water molecule. That's why when you pour out water from a cup, put it upright, you find there's still water. Not all come out. The water stick together and stick to the surface of the glass or the cup or whatever. So this is used to this kind of. So when you shine TeraHertz, what happens is that these forces are all broken. So imagine water molecules all clumped together. If you pour out water and then you put it upright, you find that the water clumped together like blobs, spherical blobs of the clump. But if you use TeraHertz to blow, you find that these forces break up the molecules, they become sheets of water. They no longer clump. And that's why the beneficial effects of TeraHertz is that it can penetrate deep because it's no longer clump, spherical blob. It's the same thing with alkaline water. They're all the same. They broke up the waves, this kind of wave, van der Waals forces, and so they become sheets, so penetrate. So TeraHertz can change the shape of molecule because you know that, for example, your egg white, which is made out of albumin, it looks liquid because it's held together. It's a long molecule, but the chains are held together by this. So it can change the shape by breaking up the force in between, and that's what's so important. And because it resonates at TeraHertz, it can have an effect on human cells and therefore regulate systems by changing the shape or the interaction between molecules, and we will go through them. So on the human body, this is what will happen. It can open up blood vessels. It can cause vibrating water to be activated because break up all the force. It can cause organelles. Mitochondria are tiny organelles inside a cell. These are the powerhouse of the cell, activated, and hyperactive cells, which are excited by infection or whatever, and cause inflammation, can be made to be normal. And the important is unzip DNA. So let's have a look at them. As far as blood vessel is concerned, it opens up blood. So normally blood from the heart is under pressure because your heart pump. You measure 120/80, so 120 millimeters of mercury, that's the pressure. And because it's under high pressure, all the water, all the nutrients, oxygen, everything leaves under pressure. So it all come out. But when it gets to the vein, the vein don't have pressure. It's a low pressure system. So the water with the carbon dioxide, with all the waste product that the cell has wants to get rid of, will go in. But because it's not under pressure, not all go in. That's why on the venous side, they are what they call the lymph vessels. Lymph vessels are the drainage, and a lot of massage has to do with massaging the lymph so that it will flow back to the heart. Okay, so that's how all the excess water, all the excess waste products get returned to the heart to be excreted. So it regulates inflammation. So inside the blood, beside the blood cells, you have all these white blood cells. They look like that. Their nucleus sometimes is segmented, and they respond to any irritation, any attack on your body. They get secreted, and they can do a lot of things to protect you against, to kill the bacteria, to neutralize, to eat up abnormal organisms that you, like bacteria, virus, so forth. Activate normal cell. Now inside the cell, there are organelles, tiny vesicle, which has a lot of property. This is where you breathe. This is where the sugar get broken up, and you have ATP. ATP is the energy molecule. So when you run, when you do anything, any movement, you need energy, and energy comes. So it can synthesize anything, even DNA, and so forth. It can also excrete. So everything that is going on in your cell, whatever your cell need to do, is all done at the level of the mind. So because it activates you, you become more energetic, more revived. Energy is produced, other things are produced, and become activated. So the other thing is, cell have a lifespan, 120 days, and after that lifespan, the cell will be broken up. Dead cells, fragments have chemicals that carry a signal called find me, eat me. So those fragments of dead cells are eaten up. The word is phagocytic, phagosome, eat them, and they are degraded, and the chemicals are then reused. So this apoptosis. Apoptosis means it's like the cell committing suicide. The cell just died. It's a cell death. This is normal. If cancer cells don't have, that's why it's grow. So this is a normal process. Keeps you healthy, and then it can sterilize bacteria. In fact, during COVID, that's what happened. People were using, a lot of clinics were using infrared radiation. They blow the lungs, and Tera also has the same effect. You can actually cause the THz can actually kill the virus. If in fact, for some of us like myself who sweat a lot, we tend to have fungal infection. This is also effective in killing fungus. So it's pretty potent sterilizing agent. So it activates DNA. DNA is in strand, double helix they call it. Now when it's in strand, you can't do anything. You can't read what is the prescription or what is menu. But when you open it, and there is an enzyme called the helicase. Helicase unzip it, and when it gets unzipped, you can read it, and you can print RNA printer to produce proteins, any molecule that you need in your body. So it can activate DNA by opening up DNA, and so that is why when you go TeraHertz, recovery takes place. Okay, now let's come to the main topic today, which is the physiology of aging. What is aging? Aging is time-related deterioration of physiological function relating to survival. Aging affects everybody. Nobody's exempt from aging. After the young is born and raised, that occurs. So in all animals, that's true. You find that whatever insects or grow from the egg to the young, and then become adult, and then they reproduce, they produce the young, and then after that they die. So that's supposed to be what happened to us. But of course, we humans don't die after that. We continue to live for quite a while before we die. Senescence, getting old, and lifespan appear to be genetically determined. It's determined by our genes. Talk more about that. It appears to be regulated not only by our genes, but by our diet, by what we eat. So what is lifespan? Lifespan is a maximum number of years that we can live. Lifespan for man has been determined to be 121, because we haven't found anybody living beyond. I know the Bible says thousands of years. We have no.
Bible 120, right?
More than that.
More than that.
100. Enoch, Methuselah lived 900 over years.
Yeah.
Yes, but
Those years.
we have not been able to verify. There was no scientist going to count. Tortoise,
15 years.
it's 150 years, not 50
Not
years.
15, huh?
150
Yeah.
years. They live very
No
long.
correction.
Life expectancy is population specific. That means a group of us. So in a certain place, for example, like China, the life expectancy is so now. Life expectancy in China is now much longer than life in US, for example, due to political and social changes. So in 18th century England and US, lifespan was that. In China in the 19th century is about that as well. I remember when I was a boy in the 50s, nobody lived beyond, most people died by 50, and a few people past 60, but that's about that, and then they die. Today people are dying 80, 90, a few hundred.
Average is what? 80.
Average, we call that life expectancy. Life expectancy is taken when half the population dies. So right now, the life expectancy of people currently living, like myself, our age group, my 70, expectancy is about 86 years. That means when you're 86, half of your cohort has died. So another half of the cohort will die after. So the younger you are, your expectancy, because you are born under better circumstances. So Singapore life expectancy 2020 83.7. Females life expectancy is greater than male. Hong Kong is thereabouts. So that's life expectancy. Why live longer? Good question. I suppose if you want a short, unimportant life, be a consumer. Consume everything and you die sweet, short life.
Just wait.
Whether it's sweet or not, it depends on your value system. The will to live longer depends on the kind of value health state. So if disease intervene, if you have cancer or some disease, or if kidney get infected and go into kidney failure, that's it. So assuming that there's good health, what are the reasons to live longer? When there's a sense of purpose, when there's a curiosity and simple enjoyment, and when there's a desire to maximum time with friend, family, basically to contribute to the community. So there's this concept of whether you are a giver or a receiver. So if you are a receiver, you just receive things, just consume things, then you may not live that long. If you are a giver, then once that gift, that sense of purpose and meaning somehow make people live long. Of course, it all depends on no matter how good you are, if your health deteriorates, then that's it. So that is determined by your genes. And how do you tell what your genes are? Look at your parents. If your parents live long, then you have good genes. At least the risk of you having stress. So one way to evaluate whether you live long or not is to look at the history, look at your relatives, see how long they live. Old age senescence lead to diseases of aging, and this is something that is real. There are diseases of aging.
What is senescence? What is
Growing old, senile. Now is senescence. So things you can do to live longer: have fun, social, and being active. These are the things you can do. Stop eating before you're full, feeling young at heart, happiness, religion give people a meaning and purpose. And in that sense, religion serve a partner. Go for a job, being social, being positive. Don't watch too much TV because TV make you sit down all the time. Somebody said if you don't move for 2 weeks, it's like aging for more than 10 years.
Wow.
2 weeks, that means you don't move.
Wow.
Oh, just sit there and watch. Okay, these are the effects of aging. One, it affects our organ system. Secondly, it affects your heart. Atherosclerosis, which is the thickening of your arteries. Your blood pressure rises in the lungs. All these things happen. Your ability to get in oxygen is impaired. Your kidneys get impaired. You can't clear creatinine. Creatinine is a waste product which is used to measure kidney function. Your gut slow down. It cannot absorb things for various reasons, and your blood sugar goes down because your pancreas and everything not to work as optimally as before. Decline in bone mass. Your bone is not able to produce cells to replace bone that are destroyed, and so you end up with osteoporosis, very soft bone. Your skin also loses the elasticity, and that's where you get wrinkles. Your body mass also declines. When it declines, your muscle cell also get wasted. So you'll find one of the indications of aging is that people, including those very fit people who are sportsmen, when they grow old and they are loss of muscle mass, you find that the skin is there but the muscle is there, and then you're dysplasia. That's the degenerative changes in the joints and all that. Together on osteoporosis, you actually become shorter. And of course, you can start improve on all of this, start implementing changes into your diet and exercise. So these are the effects of aging: skin, the nervous system, respiration, system, cardiovascular, all systems are affected. This is important. I want to talk about slide. On this side are the effect of aging. It produces all these things. Your brain decline, your heart decline, your blood pressure goes up down. Same with your hormonal system, same with your inflammation, same with your metabolic system and your muscle. If you compare aging and acute exercise, then you make yourself your body work, like running or jogging, play any game or sport. The effects are the same. So exercise should make you old, isn't it? How come it's the reverse? That's because aging, all this come in very slow. This is acute. Exercise is acute. Exercise actually causes a lot of damage to your muscle and your body. That is a fact. But because you exercise and there's acute damage, what happens? Every time your body gets damaged, your body produces stem cells. When your body produces stem cells will repair. So if you have never run before in your life, you start running, there is damage to your muscle or whatever. And after the damage, the stem cells are released, and after the stem cell release, there's repair. So your muscle becomes stronger. Each time you exercise, this thing happens, and more stem cells are released. So the result of exercise is that over time, there is repair of your weak systems in your body, and that's very, very important. That's why this is acute, this is chronic, this takes place over a long period of time, and because this is chronic, the body didn't notice it. So if you have never exercised before, you feel pain, you feel tiredness, you feel all kinds of things because of this. But I encourage you to exercise, take it slowly, but you must exercise enough to feel some effect that cause some tiredness or pain, because that's when the stem cells get released, and that's where repair. So to me, that is the most important lesson you can learn from here. Age-related disease, hearing loss, cataract, ear, eye, back and neck pain, osteoarthritis, chronic pulmonary disease, and some people get this, diabetes and hypertension, enlarged prostate, depression and so forth, and multiples of the whole. They're much more than this, but these are the major ones. I will not talk about diabetes and hypertension because in several talks I've talked about this. So I will focus on the rest, and especially those that I rarely talk about, so that there is a better understanding of that. So eyes, presbyopia causing, this is old age, where they say 老花眼. They cause hyperopia, farsighted. The lens can no longer focus on near object. You can see far, but you can't see near. It's a progressive disorder due to aging and cannot be prevented. Of course, people wear glasses, basically magnifying glasses. If you smoke, or if there's not enough antioxidants like A, C, and E, vitamin is worse. The major thing is you have difficulty reading or in dim light. It can be corrected by magnifying glasses or LASIK surgery. LASIK surgery cannot keep up because it's broke. So the best glasses. Another thing that occurs is cataract. Cataract occurs as you get old. You get cataract with your presbyopia. Then you may have to do something about it. In cataract, vision is progressively cloudy. You can't see at night, and whatever you see, there are glares and halo.
What is halos?
Aggravated halo. Circle. You see, let's say you see a light, you see a circle around the light. Glare, that means glare.
Glaring.
A flare from around the object. Being worse by UV light, smoking, and diabetes. The definitive treatment is removal of the cataract. So when you remove the cataract, you remove your natural lens, cause the clouding, and you replace it with an artificial lens called an artificial intraocular lens plant. So the difference between your natural lens and the artificial lens is that your natural lens can protect you against UV light, but your artificial lens will not protect you against you. So if you have cataract surgery, it's important to use dark glasses, so that the dark glasses that are, what's the term for it? There's a term for it, which can protect you. No, there's a term for it, a particular type of sunglasses. Not just dark, but it's this property. The name just slipped. So it must be a sunglass that can block you. When it does, then it's okay. It's complicated when there are eye disease such as glaucoma. Glaucoma is when the pressure in your eye builds up, very painful red eyes, and you may have to think. In glaucoma, the fluid builds up and it cannot be drained away. So what you need to do is to drain the liquid inside the eye, and so you may have to do both together. So
what happens you do cataract not didn't wear the sunglasses, or what happens you?
Then you get macular degeneration. Your retina get destroyed. Eventually you will be blind if you have macular disease. So macular degeneration is the result if you don't. So normal eye is this, short-sightedness is this, and this is long-sightedness. So you can imagine that if you are short-sighted and you become long-sighted, this point become here, isn't it? So that's why people are short-sighted. As they become old, they find that if they take off the glasses, they can read clearly. This is the result. It's a paradoxical effect of aging. See? So this is what cataract looks like. The lens, instead of being able to see through, you see a wide opacity. So this is a clouded lens. Cataract, instead of seeing this is what you see. Okay. Neck pain. Neck pain and back pain are very common conditions in the elderly. They are due to deterioration or degeneration of your spine in the neck, often due to osteoarthritis, spinal stenosis. Osteoarthritis, of course, is like osteoarthritis exactly is in the neck. Spinal stenosis is when the canal of the spinal of your spine get narrowed, so the nerve got squeezed. So they lead to herniation of joint cartilage. The joint cartilage is this in between your spinal vertebrae. Okay, when they get squeezed, come out like toothpaste coming out from that, and they press on your nerve, giving rise to pain. Same with if the bones of the spine get compressed, you can pinch a nerve, and that can also cause. So if you strain your neck by always on a computer or mobile screen, it make it worse. If it's just muscular, it's stiffness, neck pain, stress. If it is shooting pain or very sharp pain, that is a nerve pain. So use medication, get it properly x-rayed, get physiotherapy, acupuncture, all this help. Surgery is the last. To do surgery for your neck is to fuse the neck, put plates inside your neck and fuse it so you can't move your neck. You want to turn, you're going to turn your entire body. You can't turn the neck anymore. This happened to people with whiplash injury from auto accidents. So the spine, the bones of the spine get damaged and unstable and cause a lot of symptoms, pain, nerve, numbness, tingling, sensation, weakness. So the only way is to fuse the spine, the neck. So that's what it looks like. This is narrowing, so you have plates to hold it apart so that there's no more narrowing.
Due to inflammation, right? Cause the spine, the bone, that's the inflammation, the red color is the inflammation.
Is that?
Yeah.
Okay, so there is the compression. This doesn't show the protrusion of the disc. There is compression for whatever reason. See? The compression can be due to movement because the movement of the neck is very small but very wide movement. Your movement on the neck is very wide, and so the compression can occur. So you got to relieve the compression. This they use a plate
From the X-ray, swelling so bad.
Yeah, correct. So you see the pinching on it. These are all MRI scans. Okay? The neck is a very critical area because if it affects the nerve, it affects both the entire body almost all the time. So therefore, it's very in the elderly. This is back pain. Back pain is similar to neck pain, except the back pain is lower. So the back are somewhat restricted in motion because back is a turning motion. This is jargon. It may be front and back. The neck is much more because your head can move backwards, forwards, turn around, and all that. And with a whiplash injury, it's really terrible. Go forward and then hit backwards, and a lot of things can break.
For example, if I turn my head back, I can hear like a cracking.
Cracking sound is normal. Crepitus.
So that one can go exercise.
You get that anywhere. Any of your joint can get crepitus. But crepitus is an indication that there may be something there. In other words, if you have osteoarthritis, it can give rise to bone spurs. That means bony growths, which can press on your nerve. So yes, you can see a doctor and they may do an X-ray to make sure that there's nothing serious, or it may not develop into something serious. But crepitus is normal. It is the stiffness.
Lack of exercise. Is it?
Lack of exercise, and also the thing is your ligaments can also get calcium. So you get this crepitus. You can get it on the knee.
Why calcify? Why calcify?
Calcification occur all over the place.
Is it?
Is
it too much of calcium?
Nothing to do with calcium. It's a metabolism.
Oh.
So the wear and tear also produces osteoarthritis and spinal stenosis.
Calcium
Calcification, that means calcium deposits there
in the neck.
in your ligament, soft tissue in your soft.
So not because of eating calcium.
Your calcium pills is for you to restore your osteo.
Can cause.
No, calcification is caused by your metabolism, not the calcium in your blood. When you take calcium, we'll come to that later on. There's a slide further on. Herniation of joint cartilage, pinch nerve, all these are the same. Muscle strain leads to soreness, tightness, and achy pain. Nerve pain is hot, tingling, electric. So again, the same thing. Medication, physio, puncture, lumbar spine fusion. Lumbar spine fusion. You see a lot of people with lumbar spine fusion. The gait becomes abnormal. It's tilted to one side because, and the other thing is that it's very stiff.
Like they cannot turn their head, right? Or they must turn with the body.
Back, they can turn a little bit because fusion, there are about 5 lumbar spine. So usually fusion 1 or 2, depending on how many spine vertebrae got fused. So if you get fused only 2 vertebrae fused together, then you still can move. The other vertebrae can still move. So it depends on how many. This is This, when too much pressure, the lumbar spine has a lot of weight on it, your head as well as the body, and with the weight it can cause a break. When it causes a break, the disc, the soft part of the disc get protruded out, and then it can press on the nerve. Okay? Or it can be due to the narrowing between the vertebrae. When this area becomes narrowed, the space, the little hole where your nerve comes out also got narrowed, and when that happens, press on the nerve. And also there are bone spurs. Bone spurs are growth of bone because of osteoarthritis. Bone spurs is to make sure that your osteoporosis and arthritis are treated properly. Then it won't grow, because the bone spurs happens because of the injury to your vertebrae. So as I said, injury stimulates tissue to grow. So that's why it spurs.
Oh, you mean the overgrowing?
Overgrowing, that's right.
Yeah, come out.
Yes, bone spurs.
So
Bone spurs can occur anywhere.
how to prevent overgrowing?
Treat it properly. No. Depends on what is the cause. You got to treat the cause properly. The bone spurs is a symptom. No, you must know the difference, and that's where depends on. Also, you don't know that bone spurs have grown. You only know it when the doctor did an X-ray, and then they see something abnormal, and then growth which is not normal. Then there is a bone spur. You don't know. You can't tell your body not to grow. It's your body's response to the metabolism. See? So it's not something that you can tell yourself not to do. And it's not something that you can take calcium or not. If you take calcium for osteoporosis, there are proper way of taking it. If you anyhow take it, you get into trouble. So in the past, we don't know all this. Now I'll come to that later. I think that's exciting. Osteoarthritis in the elderly. Osteoarthritis increase with age and involve multiple joints. Surveys indicate that the incidence of multiple joints osteoarthritis is as much as 1/4 of the population. Now, that's quite a lot, 1 in 4. Now, the more joints that are involved, the worse it is. What happens is that osteoarthritis makes you move less because of the pain. And then it leads to muscular soft tissue atrophy. Your muscle dies out. You lose your muscle as a result because of the pain you don't exercise. Ironically, as I mentioned just now, exercise leads to strengthening of muscles with improved balance. So it is very important for arthritis to exercise, because the more you exercise, the stronger your muscle. Right now, I'm standing here, the weight is on my knees, right? Let's take my knee joint. The bone will be forced against each other. What protects the bones? The cartilage, right? And the fact that the muscles are moving. When the muscles contract, what happens? It stabilizes the joint. So the force is not on the joint, but on the muscle. And why people don't exercise when they're osteoporosis? Because of pain. So the muscle atrophy. You exercise, the muscle grow. You're stronger. So when you have osteoarthritis, your doctors prescribe painkillers, and people say painkillers better not take. I numb my pain and it will be worse for me. That is a big misunderstanding. Now, painkillers for osteoarthritis, their name is called, the proper name of this medication is called, so other than Panadol, which is slight anti-inflammatory, the painkillers that the doctors prescribe for you are known as non-steroidal anti-inflammatory drugs, or NSAID. NSAID. Is it just painkiller? It's anti-inflammatory. Reduce the inflammation. So you reduce your pain and your inflammation, you can start to exercise.
How far the Panadol? Head to toe or?
Panadol affects your whole body depending on how much dosage. So let's say you have, for example, for the sake of argument, let's say you have 1,000 receptors. It can be 1 million, but just for the sake of, you have 1,000 receptors in your body. If you take 1 tablet of Panadol, maybe it affects only 25. If you take 2, maybe it affects 50%. Maybe some people are more sensitive, they affect 75%. But if enough receptors are affected, the pain is much less tolerable. And you can exercise. Panadol has very little anti-inflammatory, but they are powerful painkillers that are non-steroidal anti-inflammatory. They are not steroids. Steroids suppress inflammation totally. You don't want that. You want the anti-inflammatory without the total suppression. So painkillers are used because once my wife have this belief that it's bad to take pain, and I told her, explain to her that so to take painkillers, non-steroidal anti-inflammatory. When she take that, the pain is gone, she can start to move. She can walk. When she can walk, she exercise. When she exercises, her muscles are strengthened. And that's where you recover. You see? So if you don't take, it'll be worse. You don't move, you'll lose your muscles, and then you never get cured.
Hey, Dr. Kong, what's the difference between osteoarthritis?
There are many kinds of arthritis. There are gout arthritis, there are rheumatoid arthritis, there are many kinds of arthritis. Osteoarthritis means it's degeneration, it's bone. Okay? So important, I need to explain because many people don't realize that the painkillers prescribed by doctors have an anti-inflammatory action, and that allows you to exercise and strengthen your muscle so that your arthritis can recover. When I got my arthritis in 1984, I keep on exercising. How many years now? 20, 30, 40 years now. And I still can run up the staircase. My nursing officer during reservist time was telling me that it was in the 90s, about 10 years after this happened. Also has arthritis of the bone, of the knee. And he said this neighbor of his, right to the HDB, say he has arthritis, give him a ground floor flat. That time HDB has ground floor flat. So he was given a ground floor flat. So he doesn't have to climb upstairs. He didn't exercise. 10 years later, he was on a wheelchair because they didn't look after the arthritis. Arthritis reduces mobility, and mobility make you lose muscle mass. On the contrary, I make myself more active, and the more active I am, the stronger my muscle is, right? And the stronger my muscle is, I therefore become better and better. My arthritis get less and less and less. And with TeraHertz, it's almost negligible now, you see? So that's the way to improve yourself. Okay? Yes, but it's not enough. You see, your body can produce it, but it may be at the wrong location. See, because joints is not normally an area where you experience pain, right? So when there is damage due to wear and tear, and there's arthritis, that is produced, that endorphins that's produced is not enough. So you need other things to relieve the pain, and that's why we develop all these things. And the fact is, anti-inflammatory drugs that are painkillers has a purpose, and from the advice that I've given, some people have started to take them and able to be active. The reason why we take them is that so that you can be active and recover your muscular action to protect your knee or the joints in your body. Similarly, if you have spinal problem, say prolapse disc, you protect your disc from further injury by taking painkillers. Make sure the injury is stable and do limited exercise taught by your physiotherapist. Right? Your physiotherapist will teach you what exercises are safe, and when you exercise them, you strengthen your muscle and you recover, right? That's the basis of it. So exercise, strengthen your muscles, you improve balance and flexibility. The problem is that osteoarthritis often get complicated osteoporosis, particularly in the spine. Osteoporosis can cause something called osteolithosis. That means your bones become unstable and they slip over one another, and that's when you need fusion of your lung. Osteoporosis is caused by impairment of bone remodeling. What it means is that your bones get destroyed by your body at a certain rate. Normally, production of new bone tissue will cause your bone to maintain itself. But osteoporosis comes when your bone production of new bone cell is much slower, and so you get osteoporosis. The thing to remember is that osteoporosis is not terminal. You won't die from osteoporosis. It doesn't even affect your life expectancy. You can still live a long life. The problem is that osteoporosis makes your bones soft, and so your risk having fracture. Why fractures is risky? Say you fracture your hip. You know there's a big vessel, your femoral vessel that supplies the whole of your leg, passes very near the bone in your hip and passes through the femur and very near your knee joint. If your bones get broken, if the sharp part of the fracture hit your artery, what happens? You bleed, you can die. So if there's an accident and a person cannot move his leg, the first thing the medic will do, set up a drip. It may need blood transfusion, right? Not only blood, next to the blood will be the nerve, the huge nerve that follow down. You hit the nerve, what happens? Your nerve got hit, you can't feel, you can't move. That is a complication failure. So if you're osteoporotic, you need calcium salt. And if you want your calcium to be absorbed properly, you must have magnesium together. And that is not enough. You must take vitamin D with it.
Why this on the sun?
Not enough. Because how often do you go to the sun?
We should go.
Unless you sit facing the rising sun with your back exposed, back as a large surface area for at least half an hour to 1 hour. Otherwise, it's not. You're better off taking vitamin D to make sure that you have enough. Bisphosphonates. Bisphosphonates is a medicine that can allow your bone to grow, but there's a lot of side effects. The doctor will advise. Stem cells are effective against osteoporosis. It has been proven. Okay? Treatment for elderly osteoporosis. Medical treatment is indicated to relieve pain and inflammation. That's very important. Painkillers is not just pain. It's inflammation. Exercise and physiotherapy is almost essential. I couldn't emphasize that more. Your muscle and soft tissue is very important. Exercise leads to strengthening of muscles. Use of supplements, glucosamine, chondroitin, and MSM is for your joint. Right? Collagen, hyaluronic acid is for your cartilage. There's a big difference. So all this you need to give. So stem cells and TeraHertz actually work together. Stem cells help your body to produce, or stem cell nutrition, things that you take, make your body releases stem cells. And TeraHertz, what does it do? It activates the stem cells. So it works together, and combining the two, I find has the best result. Chronic obstructive lung disease or pulmonary disease. This affects your lung. It is primarily not enough air, even though you breathe, not enough air getting into your lungs and in your bloodstream. It's usually secondary to bronchitis or emphysema. Chronic asthma can give rise to that. Asthma spread to adulthood. Associated with cigarette smoke, people who smoke end up with this. People who exposure to chemicals, dust or fume. If you work in industry like in days past, people who work with asbestos get exposed to it and their lungs get damaged, so they get into chronic obstructive. There's a genetic predisposition. There's some people who get this disease even though they are not exposed. So if you are like that, then you have to be careful. If you have a family history, that's terribly. So obstructive lung disease, chronic lung disease are two types. The blue bloaters, the pink puffers. The blue bloaters are those that arises from chronic bronchitis. Sputum turn blue because of not enough oxygen. They have swelling of the legs, cackles, wheeze, and they are usually obese. So these are the complications which you need not know. The pink puffers are the ones due to smoking. They are cough, shortness of breath. They're called pink puffers because minute ventilation, pink skin, pursed breathing. The pink is due to the carbon dioxide and the minute breathing, they are sort of puffing away. Okay, so they breathe very fast. You can hardly hear the sound of their breathing, and because of the pneumothorax of the damage, they can give rise to pneumothorax, in other words, the lung tissue burst, and weight loss due to so much effort into the breathing. So bronchitis, it comes about because of the infection of the airways, and then it becomes a pneumonia where they affect the lung tissue. So there's a lot of wheezing, you can see on the chest X-ray. If it's just bronchitis, it's usually mild. But when it becomes a pneumonia, it can be very much more severe. So this is bronchitis, it affects the pipe airways, and these are the symptoms. So when it tracks down, it becomes a pneumonia. These are the lung tissues. Okay, so that's what bronchopneumonia is all about. Emphysema. Emphysema is destruction of the lung tissue, the air sacs. The air sacs become inflated, the walls get damaged. Long-term exposure to irritants such as cigarette smoke, which is just now as a result of smoking and irritant, cough, rapid breathing, shortness of breath. Life expectancy 5 years. So that's what happens. Destruction of the air sac, it will destroy. So the tissue for absorption of oxygen is much less. They couldn't get in enough oxygen, and this is smoker's lung. Smoker's lung look like that. There is no cure for emphysema or chronic obstructive lung disease. Treatment is rehabilitation and medication. Stop smoking, start exercising. Not all smokers get this, by the way. There's a genetic component. I think there's a famous person who smoked. I can't remember, but it was featured recently in some news because of this one. Warren Buffett, is it? He drank five cans of Coke every day. And then they mentioned somebody else smoked like a chimney. So the only thing is that you make sure you're vaccinated against the infection to make sure that the infection doesn't kill you. The chronic lung disease is not that there is a hope. TeraHertz can help. Stem cell therapy has been tried as something that works. Okay, prostate. Prostate is a disease of old age. It's non-malignant. There's no link with prostate cancer. For a male, if they live long enough, they will have prostate. At 50 years old, half of males will have prostate enlargement. By 80 years, 90% have prostate. It's associated with presence of testosterone. In other words, we know that the more a person has testosterone, the more you will have prostate enlargement. And interestingly, we know that the testosterone seems to stimulate stem cells in the prostate to be active and produce prostate tissue. So in a sense, we've been trying to block the stem cell activity inside the prostate, and that's what I've been done. One of the treatments associated with this. So if you have diabetes, obesity, all this, it make it worse. Blockage of the prostate enlargement can block the urethra, urine infection and dribbling. When I was practicing in a surgical ward many years back, you get people coming in, males, elderly males, who cannot pass water for the last 2 days, 3 days. And you put a catheter in, what a relief, you can drain out the urine. And
Wait, is it a bladder thing? No, prostate is not a bladder.
prostate, you see a picture. So the stasis caused by blockage can cause renal stone. Maybe I show you. This is a prostate. It is below the bladder. So when the prostate enlarge, the urethra, the urine comes from the bladder go through the prostate before it comes out. So when it enlarge, it narrow the outlet for the urine, and that's where all the problem. If you put in a scope, this is what you see. This should be a hole, but the prostate enlargement narrows the hole. That's why they have urinary retention. So when you have urinary retention, you can go to the toilet many times a day. You can be very urgent, and yet you have trouble initiating your urine, and your urine get interrupted, and you dribble, and now you want to pass urine, pain after urination or ejaculation. So your bladder get overworked, and this is a real problem for almost all males. So maybe as you specialize in urology, you get more of this all the time because almost all males have this problem.
We never heard of it.
Because people die young. Once people go beyond 70 years old, you begin to see this. In fact, from 60 onwards, you start to see enlargement. So these are the results. So this is a cross-sectional view. Urine pass through normally. Normal prostate. When the prostate enlarges, narrows it. Urethra, the tube that allows you to pass you. Okay. So these are the symptoms which I've gone through. These are the risk factors. So treatment, oral medication to cut off the stem cells in the prostate are very specific to, and they're stimulated by testosterone. So if you can cut off the link between the testosterone and the stem cells in the prostate, then the prostate will not enlarge. You see? So this is one where you don't want to use stem cells for that reason. So lifestyle change is needed. There are several surgical methods to remove the tissue. Once you have medication to cut off the link between the testosterone and the prostatic stem cells, and then you use a surgical technique, use lasers, vapor, heat, water, or the traditional method, scrape the prostate bit by bit. I once was helping a surgeon doing a prostate surgery. He was putting it in and he was scraping it piece by piece. And every time we flush, you can see all the prostate tissue all coming out. It's very laborious, takes a lot of time.
But there's no purpose of no purpose by on its own.
The purpose of the prostate glands is to produce the secretions that are needed during sexual intercourse, and basically it has to do with urinary function. So I'm not very sure on this, but there are similar glands in the female. The similar gland. It serves a certain function. But the prostate is unique in that because it's linked up with sexual function, it's linked up with the sex hormone testosterone. And prostatic stem cells that have been discovered get stimulated by testosterone and cause the prostate to enlarge. Now, of course, they discover that if you can break the link, if you have a medication to break the link, testosterone and the prostatic stem cells, after some time, the link is broken. So this is something that's quite unique. I mean, we're learning all the time. Some of these things we only know lately. So, but of course, there are better techniques of removing prostate with water vapor. So TeraHertz is quite useful. TeraHertz appear to be able to shrink the prostate. The thing is, TeraHertz, traditionally you were taught to blow from here. But with experiment, I think you can blow here or you can blow from above.
Just along the stomach.
You aim it downwards. This one you aim it
The groin
backwards.
area.
Yeah.
The groin area.
Yeah.
Come here, not this way, not
Can the
This way, right at the bottom.
yeah, from front.
Yeah.
for the female, can the TeraHertz be done for the womb in the front
Yeah, you can.
or by the back?
Womb is more behind.
More
The
behind.
front is the intestine. It's behind all the intestines and the
But then when
liver.
we blow here can get.
It can't penetrate. With too much
Is that
tissue.
20 to 30 cm?
You must remember your tissue absorbs TeraHertz.
So do the back here.
You got to do the back. You
Is
must,
it good for fibroid? No
I'm
idea.
not sure.
No idea.
I am not sure.
Somebody asked me.
Huh?
Somebody asked me.
You ask a question now.
So I
If
said,
you are a
ask
member of my
about the-
Q&A, you can ask me. I'll give you the answer.
Somebody asked me.
Thank you for your comeback. Nice. A lot.
So these are prosthetic surgery. Go in and eradicate it. These are means of removing it, or to inject water vapor or laser. This is important. Some foods aggravate, some fruits improve. Basically, if you look at the disc, you recognize that fresh fruit, fresh vegetable allows you to improve your enlarged prostate. Whereas red meats, alcohol, fats, trans fat due to fried foods, spicy food, all this aggravate prostate. So this is useful if enlarged prostate is an issue. So other things that you can do, we know that fruits and vegetables help, limit fluid intake at night, maintain healthy weight, regular exercise, pelvic floors, avoid cycling seems to make prostate worse.
Cycling?
Yeah.
Ah, wow.
Yes, it has been found. So double voiding, so void and then void again,
Wow.
that's double void.
What do I avoid so long?
Yes, coffee and alcohol can cause
You know,
a lot
Dr.
of...
Kong, I recently got this customer bought the blower. It's elderly man, so it was some years back, 10 years. And then after that, the doctor go and use on the bladder. Do you know what kind of heat very hot. So you know what happened? After he used this blower, at night, I go to the toilet, sleeping 5 times, right? A lot of urine, but then he can sleep back again. So he was worried to use blower. So he stopped using the blower on that part line, but only on the leg on it. So is there a kind of reason why when you use it on the body, king like, he said you just use a little while, it becomes like, wow, then when he got
Well,
get up 5 times.
TeraHertz improved drainage, so he must have some water accumulating
So
elsewhere.
is it a good or bad thing to continue?
It's a bad thing.
Huh?
It's a bad thing. It's a good thing.
It's a good thing.
Because it drains. If he end up passing a lot of water, that means there's some water accumulation.
But then why only when he was sleeping, he got to get up at 5 times. 5 times, that means the kidney is weak.
I don't know what happened. I don't know the details of this, so I can't explain. I can't explain because I don't have enough.
Okay, generally the TCM said when people sleeping, you should not go to toilet, then it's weakening your
It
strength.
depends on what happened. I think that it depends on your habits. And it doesn't mean that going to the toilet at night not okay.
While sleeping, wake up again and go to toilet. Sleep.
Yeah, people do that.
But strange, there was one customer here, so he's 88 years old. Then so he's strange bought that one. The olive. Said that no, never buy it. Then come in there. Said that night instead of 5 times he goes. So the second day he came, he tried again.
Maybe complete the top
Oh, okay, okay,
then
sure.
we Q&A.
Not enough details.
sorry.
I can't explain.
Yeah.
So
You're almost done, right? I suppose.
we are coming to so BPH, prostate enlargement, is related to erectile dysfunction, and they can lead to one to another. And treatment of prostate enlargement may lead to ED. So you have got to look at this thing. And obviously, if you have heart disease and diabetes, worse. When you have other disease, it's always complicated because all these diseases cause water retention. Okay? So in the end, if you normalize your function of your prostate and all that using TeraHertz and all that, it's likely to be better. But this is a very complicated issue, and each case has to be determined in marriage because the two are very closely related. It's aging and illness. We say just now aging is unique. They have gone through some diseases. Some years back, in the new classification of diseases, old age was coded as a condition, so it's a disease. But it was later withdrawn and replaced by aging-associated decline in capacity. And throughout the centuries, people have been looking for the elixir of life. That means you drink that and you can live forever. Qin Shi Huang was supposed to be looking for this, isn't it? At the molecular level, taking supplements and all that, we can reverse many changes of aging. However, it's unlikely that we can live forever. So, what is healthy aging? Healthy aging is a process to keep on optimizing opportunities for physical and mental health so that you have a quality of life while you're alive. So good medical care, vaccination, good diet, exercise, all this help. More and more people are able to act and feel young. But we know one thing, overcrowding leads to aggression, violence, and normal states of, you heard of lemmings? Lemmings are animal in the northern hemisphere. They traditionally, the population multiply and then suddenly all of them will crawl and fall into the sea and die.
Is it? Wow.
So lemmings is a story where when there's overpopulation and overcrowding, people will just die, starvation, predation.
So lemmings refers to human beings.
So right now we are faced with overpopulation and climate change. This is known as a tragedy of the common. Tragedy of the commons refer to a situation where we have a common resources, like for example a field, and if everybody take their cows and their goats and everything and eat the grass in the field and nobody take care of the field, eventually the resources are used up. That's a tragedy because it's common property, nobody take responsibility. So these two, overpopulation and climate change, can end our ability to live. The other thing is our gut microbiome. In your gut, in your colon, there are trillions of microorganisms, more than 1,000 bacteria. Our genes have 23,000 species. When your microbiome can have 3 million over genes and they produce thousands of metabolites. So indeed, we believe that genome, the bacterial genome inside your colon, contributes many immune and metabolic. In fact, we now know that type 2 diabetes, autism, heart disease, colon is due to a bad microbiome. In other words, you don't have the right bacteria to support. So how did, if the gut microbiome is so important, how did it get depleted? Too much antibiotics use, a diet high in sugars, fats, low in fibers, a lot of stress, not enough sleep, allergies, asthma, obesity, probiotic fermented foods help to restore the bacteria. So it is important. And some years back in Sweden, a person with very poor gut microbiome, he was given a fecal implant, a fecal transplant. In other words, feces was taken from a normal person and put in his colon. Why? Because they want to replace the microbiome with good microbiome, good bacteria. So that's what the human microbiome. So unhealthy lifestyle leads to poor microbiome, all kinds of diseases, obesity, Healthy diet leads to good microbiome, and you're normal. That's the long and short of it. So it's important that we eat a normal, healthy diet of fresh food, especially vegetables and fruits, as well as the diet. Avoid red meats, and that's what happens. So the gut microbiome is very important. How do you optimize it? There's no replacement for exercise. Diet is critical. Diet is something that all the time. Sleep, reduce stress, meditate, be connected with people, and live a life. This is spiritual. Yes, people talk about spiritual in a sense that there is meaning and purpose. So it includes being religious as well. Use supplement wisely. Match supplements with your needs. Don't take any supplement because somebody says so. Look at your risk profile, your personal, your family history, environment. These are the most common causes of disease and death. So supplements for joints, bone, heart, nervous system, and cancer. Important. Use of TeraHertz, stem cell. There is a stem cell nutrition which I would recommend. Why I recommend it? Because besides giving you stem cells, this supplement has antioxidant, anti-inflammatory, anti-cancer, antibiotic, anti-diabetic, as well as a positive effect on eye, skin, joints, and the heart. Yeah, so proper use of supplement, TeraHertz, stem cell injection when needed, and this is so. In life, we need to make choices. We can choose to be healthy or we can choose to be angry. We can have a good, healthy outlook in life, nutrition, exercise, or we can live a life where we drink and we eat all kinds of things, without any regard. Take steps to go astray, be connected to people, and have a healthy life. So that's what I would recommend. So we don't use TeraHertz for all this. We use TeraHertz for inflammation, pains, blockages, skin, most effective.
Practically everything can.
Practically
Well,
everything.
unless there's a-
Exact pregnancy, acute diseases, congenital disease. Implant also can.
Implant also can.
Yes.
It doesn't matter with the metal thing.
Depends on what is the metal. If it's titanium, you can.
Titanium.
Open wounds, you can.
Then they were saying can use number one, so I said, still okay.
Later. Okay.